Let's jump straight into it. Number 1, bloodletting. This treatment killed people by slowly emptying them. For over 2,000 years, bloodletting was considered one of the most reliable medical treatments in the world. Doctors believed illness was caused by an imbalance of bodily fluids, and the fastest way to fix that imbalance was to remove blood, a lot of it. Patients were cut with blades or pierced with lancets. Veins were opened deliberately, bowls filled, leeches were added if more blood was needed. The goal wasn't a small sample, it was volume. People were bled for fevers, infections, headaches, pneumonia, and even mild discomfort. Weakness after the procedure was considered proof it had worked. If the patient fainted, that was also seen as a success. The problem was that sick people don't need less blood. Many patients became dizzy, confused, and barely able to stand. Some went into shock. Others developed infections from dirty tools. If the illness didn't kill them, the treatment often finished the job. One of the most famous victims was George Washington. After developing a throat infection, doctors removed nearly half his blood in a single day. He died shortly after. Bloodletting didn't fade away quickly. It lasted because doctors trusted tradition more than outcomes. People weren't dying from disease. They were being drained to death. Number 2, mercury medicine. This cure poisoned patients slowly and confidently. For centuries, mercury was prescribed for everything from constipation to syphilis. Doctors knew it caused severe side effects. They just believed those effects meant it was working. Patients were given mercury pills, ointments, and vapors. Gums swelled, teeth loosened, mouths filled with sores. Saliva poured uncontrollably. Tremors developed, memory faded. Doctors called this salivation therapy. The goal was to push the body to its limits and hope the disease gave up first. In reality, mercury attacked the nervous system. Patients became confused, paranoid, and physically unstable. Many couldn't walk properly. Some developed permanent brain damage. Others died from organ failure. Syphilis patients were often treated until they either improved or collapsed completely. If someone survived, the mercury got credit. If they didn't, the disease took the blame. Mercury remained popular because it looked aggressive. Doctors were doing something, patients felt something. That feeling was poisoning. Number 3, lobotomies. This treatment destroyed the problem by destroying the person. In the early 20th century, lobotomies were promoted as a miracle cure for mental illness. Anxiety, depression, schizophrenia, and even mild behavioral issues were considered targets. The procedure involved severing connections in the brain's frontal lobes. Early versions required drilling holes into the skull. Later versions used a tool inserted through the eye socket and hammered into place. The procedure took minutes. Patients often became quiet afterward. Doctors interpreted this as success. What actually happened was devastating. Many patients lost their personalities entirely. They became emotionally flat, confused, childlike, or unable to care for themselves. Some lost speech. Others lost control of basic bodily functions. Deaths weren't rare. Brain swelling, bleeding, and infection killed many patients outright. Survivors often required full-time care for the rest of their lives. The treatment spread rapidly because it made difficult patients easier to manage. Overcrowded hospitals embraced it. Families were told it was the best option. By the time the practice fell out of favor, tens of thousands had been permanently damaged or killed. The illness wasn't cured, it was silenced. Number 4, radium therapy. This treatment made people glow and then fall apart. In the early 1900s, radium was considered a miracle substance. It was radioactive, mysterious, and new. Doctors believed it energized the body and restored health. Patients drank radium water. They inhaled it. They wore radium-infused products. It was prescribed for arthritis, fatigue, impotence, and aging itself. At first, patients felt better. That was the problem. Radium temporarily stimulated cells before destroying them. Over time, bones weakened, teeth fell out, jaws deteriorated, tumors formed internally. Some patients developed fractures from minor movements. Others suffered internal bleeding without visible injury. One wealthy patient consumed radium daily for years. His bones later emitted radiation strong enough to expose photographic plates. He died slowly and painfully. Doctors had no antidote. The damage kept happening long after treatment stopped. Radium therapy didn't heal anyone. It just delayed the damage long enough to hide it. Number 5, insulin shock therapy. This treatment put patients into comas on purpose. In the 1930s, insulin shock therapy was introduced as a treatment for schizophrenia and severe mental illness. Patients were injected with massive doses of insulin to force blood sugar levels dangerously low. The goal was to induce a coma. Patients convulsed, sweated, and lost consciousness. Doctors monitored them until they collapsed, then revived them hours later with glucose. This was repeated daily for weeks. Some patients didn't wake up. Deaths were common. Brain damage was common. Survivors often had memory loss, confusion, and personality changes. Hospitals continued using it because patients sometimes appeared calmer afterward. Whether this was improvement or exhaustion was rarely questioned. The therapy declined only after safer treatments emerged. Until then, doctors induced near death repeatedly and called it medicine. That's enough history for one video.